Welcome back to another episode of MedCity FemFwd. I'm Marissa Plesha, reporter for MedCity News. In this episode, we're joined by Priyanka Jain, co-founder and CEO of Evvy. Evvy is a digital vaginal health company that is supporting women's health research. It is also a founding member of the Milken Institute's Women's Health Network, which is a collaborative designed to support the women's health ecosystem. Hi, Priyanka. Thanks so much for joining MedCity FemFwd.
Hey, Marissa, so good to see you, and thank you so much for having me.
Yes, of course. So happy to have you. Maybe just to start, so you're co-founder and CEO of Evvy. Can you tell us a little bit about why you built Evvy and some of the problems in healthcare that you're really trying to set out to solve?
Absolutely. So I started Evvy after my own personal set of experiences, as I think so many founders in women's health do, just feeling like I couldn't get answers or solutions when I was going to the doctor. And as I did my own research, I found out that women weren't in clinical research until 1993 in the United States, and that to this day, women are on average diagnosed 4 years later than men across over 700 of the same diseases. And that really, first of all, blew my mind. Second of all, made me realize like, oh, wow, my problems are not me problems, but it turns out these are actually really large systemic problems. And it really pointed to an opportunity in my mind, which was that there's so much data on the female body that we're just not leveraging in healthcare today, right? Essentially, we only ever studied middle-aged, mid-sized white men. We figured out what was predictive of health and disease in that population. And those are the things that we choose to measure and track when we think about health and disease in all people today. And I became really excited about this idea that the female body has so many unique signals, right? Is constantly trying to tell us where things are going well or where we need help. But we're just not measuring or tracking any of those signals when we think about health and disease because they didn't exist in men. And so at Evvy, the high level problem that we really wanted to focus on was bringing better leverage from these female-specific biomarkers to help us better predict risk of disease, diagnose disease, and treat disease as it uniquely manifests in women.
Yeah, super interesting. And so going off that, can you tell us a little bit more about, the products that you offer? You have the flagship vaginal microbiome test, and you've also since expanded to offering care in addition to that test. Can you tell us a little bit about what it looks like from the women's perspective going through your company?
100%. Maybe before I tell everyone about the test, I'll even just explain what the vaginal microbiome is for anyone who doesn't know what it is. But hopefully people are familiar with the concept of a microbiome, right? So the idea that there are bacteria and fungi and little microbes that live on or in different parts of your body, right? People are probably familiar with the gut microbiome. There's also one in our mouths and on our skin, and also in our vaginas. And the vaginal microbiome actually plays a really important role in our overall health outcomes as women. And the way it does that is when the vaginal microbiome is in a healthy or protective state, it's dominated by these healthy and protective bacteria, the most common of which is lactobacilli. Maybe you've heard of that. And what those lactobacilli do is they produce lactic acid, so they make the vaginal environment acidic, and they also take up space on the vaginal wall. That way, when pathogens or bad bacteria inevitably get into the vagina, because it is frankly just an open gateway, they aren't able to survive. It's too acidic, there's no space for them. And so in that way, the vaginal microbiome actually acts as this really important barrier layer for the rest of the reproductive tract. And when it breaks down, God forbid you have sex with someone new, or you sit in your swimsuit for too long, or you have a long period, all of those things can increase the vaginal pH, can allow some of those bad bacteria to replicate. And when that happens, we as women experience that as bacterial vaginosis and recurrent yeast infections and recurrent UTIs. And these are actually the leading reason that women seek healthcare advice in America, right? So these are really, really prevalent problems. But what we're not thinking about is that now we've actually lost that really important barrier layer, right? And there's so much research showing that when that happens, it impacts outcomes in fertility, whether that's natural fertility, IVF success rates, miscarriage rates, preterm birth rates, cervical cancer progression rates, STI acquisition, endometriosis relapse, you name it. And I just couldn't believe that nobody was using data on the vaginal microbiome to help the leading reason women seek healthcare or to predict and improve outcomes throughout our lifespan in all of these critical areas. So that is the vaginal microbiome and kind of why we chose to start there. And to explain a little bit more about our actual product, Our flagship product, as you said, is the Evvy vaginal microbiome test. And essentially, it's the first ever platform to bring whole genome sequencing to the vaginal microbiome at scale. And so a patient can come to Evvy directly, typically for one of two reasons. One is that the patient is experiencing vaginal symptoms, so whether that's vaginal infections or vaginal symptoms related to menopause. And the other reason is around fertility and pregnancy outcomes, right? So they're either trying to get pregnant or they are pregnant and they want to improve their outcomes in that arena. Those are the two main drivers. Of course, we have an amazing contingency of women who are proactively taking care of their health, which we love. But today, our two primary customer types are in those areas. They are able to order the test online. It comes to their house. It's like a Q-tip swab of the vagina. It takes 20 seconds. You mail it back to our lab. We then do metagenomic sequencing, where for the first time, patients and doctors can actually get an answer to what is going on. We always say it's like turning on the lights, like just show me what's there. And so for the first time, patients and doctors can get that comprehensive answer to how much is good, how much is bad, what type of bad, which specific microbes is it? And that's kind of like we always say, like, know what's up down there. Like, we help patients and doctors get to that answer, to that much more specific diagnosis. The second part of our platform, as you alluded to, is taking that really comprehensive molecular data, combining it with what we know about the patient. So she has these specific symptoms, she's in menopause, or she's postpartum, or maybe she's on a certain birth control. All of that is obviously playing a role in the vaginal environment. So we take that all into account. We much more precisely stratify the version of health or disease that that patient is experiencing. And then we use that to predict the specific treatments and ingredients that are most likely to help that patient get better. And we then are able to actually prescribe custom compounded vaginal suppositories with exactly those ingredients and send them to the patient's store. And so the end-to-end platform basically helps patients get answers to what's going on, and then also helps them improve their outcomes.
Yeah, super interesting. Thank you so much for sharing that. I also want to ask you, so as a women's health startup that isn't solely focused on maternal health, what have been some of your experiences trying to get venture funding in an area where a lot of venture capitalists are men? What have been some of your experiences trying to explain some
How
of
long
these,
do we have?
however long you
Oh,
want to go?
no, I'm laughing. I mean, look, I not only do I not run a maternal health company, but I run a vagina company. So the stories are endless. I think that what I will say is that I think over the past, we started Evvy almost 5 years ago now, and things have changed a lot. I think that now people understand that women's health is an exciting market, that there are a lot of problems to solve, that there are real business opportunities. I still think most men and sometimes women in the room like shirk a little bit when I say the word vagina for the first time. But usually by the end of the meeting, people are like asking me a question that has the word vagina in it, which is always very exciting. So I think there is definitely an upfront discomfort. I mean, one of the stories I have is from when someone introduced me to the founding partner of a fund who was a man. And the man responded to the email saying, I don't feel comfortable taking this call, but I've added my associate, who is a fresh out of college junior associate, who can take this call because she was the most senior woman at the firm. And, people always say to founders, get introduced to the top, to the decision maker. And I think the feeling of like, wow, there is not someone at the top who is a decision maker who is even comfortable talking to me about a problem that is the leading reason that 50% of the population goes to the doctor, and they were a healthcare investor, is concerning. Tons of stories of VCs who asked if we could send tests to their assistants so that they could ask their assistants about the experience. And I remember having to say, are you sure your assistant wants to talk to you about vaginal odor? Like, I don't think that's really a fair thing to ask them to do. And so there are absolutely barriers. But my optimistic side, because you got to be an optimist as founder, is that people do want to be educated. They do want to learn. And so I think the unfair burden that is put on women's health founders is like, you have to do so much education. But what I have found is that when you do that education, when you show people the numbers, the opportunity, the markets, it's impossible to ignore, right? And so I think that you can't really lead with the moral righteousness. You have to lead with the data and the opportunity.
Yeah, so well said. And I think it kind of goes back a little bit to what you were saying at the beginning about the lack of women's health research. Women weren't included in clinical trials until 1993. So going off of that, what are some of the things that you're really doing to improve women's health research going forward?
Such a good question. So I think first is on our own platform, we actually have invested the dollars, time, and energy and effort to actually study our own platform. So we've now published peer-reviewed studies that show that our test, we published the full methodology of our test and showed that it was much more accurate and comprehensive than anything else that exists in the market in our space. And then we also published, we just a few weeks ago, I think, published a study on peer-reviewed outcomes from our care platform, where it was the largest study of at-home vaginal health care ever done. And we showed that we were able to significantly improve both symptom resolution as well as reduce recurrence rates. And oftentimes, Evvy is seeing the hardest patients. I think it's something like 85% of our patients have already sought care through the traditional system, and we're still able to show that we were able to improve outcomes for that population. So I think first is furthering the research on our own platform, but really the reason we started Evvy, back to what you asked me at the beginning, is around this data gap. And one of the things that I'm the most excited about is that Evvy today works with over 75,000 patients and over 2,000 medical practitioners across the country. And we've now built the world's largest data set ever on the vaginal microbiome. Excitingly, 98% of our patients actively opt in to research, meaning that they consent to us using their data to actually further the scientific and medical research on vaginal health. And now we've actually been able to present our data at essentially every major clinical conference focused on women's health or vaginal health. And now we're getting to educate the doctors and really change the way that vaginal health is handled at the bedside for patients day to day. And so I feel very excited about the ways that we can use the data set to, one, improve the experiences that these women are having at the doctor's office every day, where at least their doctors can say to them, instead of saying, it's in your head, you're fine, say, oh, I actually heard something at a conference where maybe there is something else going on, and like, you're not crazy. Like, even that small change makes a big difference. But then also, how can we use the data set to unlock new diagnostics or new therapeutic opportunities, right? Could we find markers to predict IVF failure or preterm birth or cervical cancer progression or stage of menopause or endometriosis or PCOS? These are all things that third-party research has shown that the vaginal microbiome is very high potential for, but no one's ever had data at scale to identify those specific markers. So could we do that? Could we find new targets that could unlock new treatments that could actually mitigate some of those conditions? And so I think we feel very excited about the opportunity that lives within the data to actually not just change outcomes with our platform, but use the data to change outcomes for women everywhere.
Yeah, that's really great. And you also were just recently selected as a founding member of the Milken Institute's Women's Health Network. Can you talk a little bit about what this network is and what your role is?
Yeah, absolutely. So I'm extremely excited that it exists. I think there's so much great work going on in women's health. I mean, you cover so much of it. So first of all, thank you for that amazing work you do, lending a voice to the space. But I think oftentimes it feels like it's happening in silos, right? There's the people doing the research, there's the people working on the policy, there's the innovators, there's the investors. And I think what's exciting about the Milken's Women's Health Network is that it's bringing together all of those different groups into one room with the goal of accelerating innovation. And so I think their focuses are driving investment, driving research, and driving collaboration. And so I'm really excited that we get to bring the lens of innovation, right? We can bring the patient perspective. We can bring the perspective of what technology can do and how quickly we can do things. And so I really hope that by putting all of the people in the room, we can avoid duplicating efforts and that we can actually accelerate scaling some of the innovation that we know works.
Yeah, absolutely. So looking ahead, what are some things that you really hope this Women's Health Network is able to achieve in the next few years?
I mean, I would love if it helps us increase funding for the space, both from a private sector standpoint, someone like Dr. Jill Biden chairing it and helping advocate for it. Hopefully that brings more private funds to the problem. And just to touch on that for one quick second, I'm sure people listening to you probably already know this, but that when you look at private venture funding today, I think it's something like 3 to 5% of venture funding in digital health goes to women's health. So there is a huge dearth in that regard. And to the point you made earlier, actually 67% of that 3% goes to solutions focused on fertility and pregnancy. And so there's so much more to women's health that is not being covered there. And when you look at it on a global level and you look at kind of the biopharma spend across diagnostics and therapeutics, I think it's 1% of the global R&D spend is going towards women's health. And that's let alone in the US, where I think it's something like 4% of the NIH budget is specifically focused on women's health. And as you probably know, there's obviously these crazy proposed cuts to the NIH budget. And so I think however we can advocate for funding and prioritization of women's health to happen at the kind of government level, but then also in the private sector, I think will be massive. And then I hope that honestly, we find ways to accelerate the innovation. I think that there are so many promising, extremely exciting women's health companies. Obviously, Evvy is one of many. And I think that there's this big gap that exists between kind of getting to the point where you've proven you have a product that works, that people like, and then actually getting it to scale, right? And I think, frankly, when we think about investors, the biggest gap that exists is in that kind of growth stage investors for women's health. And so I hope that they're able to help women's health innovation cross that chasm and really get these companies to scale to reach the women that they can help.
Yeah, absolutely. And you also just mentioned that Dr. Jill Biden is chair of the Women's Health Network. She led a lot of efforts during the Biden administration to advance women's health research, a lot of funding efforts as well. I think it's safe to say that the current administration has not been as focused on women's health research. So I'm just curious, what are some of your thoughts and concerns there when it comes to the current administration?
Another question that we could spend hours on. I mean, look, I think that my concerns are in two buckets. I think one is the spread of fear and misinformation. I mean, you and I are talking the day after Trump said that Tylenol causes autism in babies. And so I think that it's already so hard to be a woman and try to understand all of the science and research that you feel like you need to know to be a good, to be good to your own body, to be the best mom you can be. I mean, I think the fueling of misinformation and fear and uncertainty is so terrifying. I mean, we saw this happen with mifepristone last year, same thing, where they are breeding fear and uncertainty. And I think that's happening not only at the patient level, but then also at the doctor level. Am I allowed to do this? Is this legal? And that delays care in critical moments that it shouldn't be happening. So I think one is that deep fear of the misinformation that's being created. And then two is in just like the literal breaking down of any and all systems that helped fund women's health. And I think, well, one, I think they proposed a 50% budget cut or 40% or something like that to the NIH, which is just abysmal. And I mean, even putting my women's health hat aside for a second, it's like, what makes America great? If we're going to ask that question, it's like, we are the beacons of innovation, of science. We created a COVID vaccine faster than anyone else could. Like, why does that happen? Because scientists want to be in America, where we care about basic research and science. And I think it's just so short-sighted to not invest in that. And then when you take the women's health specific lens, I'm sure you saw this, where I think it was the NSF had a list of like banned terms, and obviously the words women and female were on it, but not the words men and male. And so just this idea that we are targeting women's health research as something that should not be funded because it is gendered, because it has a political agenda, instead of just saying we're studying 50% of the population that, by the way, we're decades behind in understanding. I think it's just a tragedy. And I think it's a tragedy not only in terms of hindering the scientific advances that we could have that could improve patient outcomes, but I also think it's a tragedy because we're going to lose female scientists, right? We're going to lose these young women who were going to go into that field, but now aren't going to do it anymore because they don't think that it's an economically viable career for them anymore. And we will feel the ramifications of that, not just over the next few years as we delay innovation, but over decades as we lack those researchers who would have had those really important positions.
Yeah, so well said. Thank you for sharing that. I'm just curious, in your conversations with maybe some of the other founding members of the Milken Institute's Women's Health Network, or some other women's health startups or other, just in general, others in the healthcare industry, what are some things that can be done to kind of combat some of this misinformation about women's health?
It's a great question. I mean, I think that what we're all trying to do is like scream out loud the truth, right? Like, I don't know if it's because I live in a women's health bubble, but my whole Instagram feed is people talking about no, Tylenol is safe. Look at all these studies that were done. There is no evidence to really corroborate what's being said. And so I think it's in these moments of fear and uncertainty, if you have a platform that women trust, we need to be using it to spread real research and truth and real information and be there to answer questions when women are confused. And I think the beauty of technology and startups is like we reach patients every day, right? Evvy has a large following and a large platform, and we can use that to kind of combat the misinformation that's happening. And then frankly, I think that the other piece of it, and I feel personally very much like I want to contribute to this, is like we have to create economic value in women's health. Like, unfortunately, we live in, or not unfortunately, but we live in a capitalist society. And I think that women's health can't, it's what I said earlier, it can't just be the morally right thing to do. We have to show that we can build real companies in this space. And that is one of the ways that we can help kind of bring more resources to this problem from the private sector when the public sector is kind of stepping away.
Yeah, absolutely. Well, just one last question for you, Priyanka. What's next for Evvy? What are some of your priorities in the coming years?
Great question. We're really excited about a few things. So one, obviously, we continue to scale access to our platform, both to patients and to providers, to help them get better answers around vaginal health and better solutions. That's obviously first and foremost what we're doing all day, every day. I think the frontier that I am the most excited about right now is leveraging our platform to improve fertility outcomes specifically. And I think you and I have talked about this in the past, that all of the research that exists that shows that when you have a disrupted vaginal microbiome, you have these higher levels of inflammation and infection in the reproductive tract, and you see higher rates of IVF failure and infertility and early and late miscarriage and preterm birth. And to me, the fact that something as simple as a 20-second Q-tip swab of your vagina could reveal that information, and, you know, these suppositories that don't carry risk and that are, you know, pretty easy to use could actually mitigate something as emotionally and physically difficult as fertility and pregnancy are, I think is just such an exciting opportunity. And so in that space, we've already actually identified 4 really interesting markers that are predictive of fertility outcomes. And now we're actually running a large-scale study with the largest network of fertility clinics in the US, looking at if we can identify the very specific markers in the vaginal microbiome that predict IVF failure. And so we're incredibly excited to, 1, be able to fund and run that research, and then 2, to actually take those insights to patients and clinics so that we can avoid unnecessary failed cycles. And so I think we're extremely excited about what we'll be able to do in that space and the impact that will have for patients and doctors.
Yeah, super exciting. Best of luck with you. Best of luck to you on those efforts. Can't wait to hear more. Well, Priyanka, thank you so much for joining. Really appreciate it.
Oh my gosh, of course. Thank you so much for having me.